Hello guys, I'm Dr. Gökay Bilgin from Smile Hair Clinic. Today we will see our patient's Marcos hair transplant journey. If we look at his pictures before the operation, he has a small amount of hair in the mid-scalp and he needs hair transplants in the crown and in the front part of that. We will try to, of course, extract maximum amount of grafts as always. He has a good donor zone, his density is good and his hair is thick at the donor zone, so it gives us a really good opportunity to cover it all one session. So we drove him a hairline. Actually it's a little bit higher than it should be because we want to cover with a higher density, and the only thing we can manipulate is our design. So at the start, if we come up with a good plan, if we choose a war that we can win, it's always the best for our patients. So we drove his hairline, we implanted in the crown and in the front. So if we jump to the first month, as you see, all the hair implanted has shedded. He had shock loss and he still some have redness. This redness really depends on the patient's skin condition. So some people really suffer from redness like 2 or 3 months, but for some people do not have redness even after 2 weeks. So we will go to the third month. His hair started to grow, especially in the front, but the crown, as I always say, grows a little bit later than the front, so he really do not have much more implanted hair in the crown. Go to the 6th month. Yes, in 6 months you can see donor zone is totally healed. You cannot really understand and tell that he had a hair transplant and some of his hair extracted, because as I said before, he had a really good donor zone, especially with the thickness of the hair. His donor zone looks great actually in the 6 months. The hair implanted to the front mostly grow, and the crown is a little bit different, as I said. He still needs some density there in the 6-month mark, but it also started to grow there. If we check the 9th month mark, yes, he's in a barber actually. Most of his hair is grown, but still in the crown he needs some density increase. And we will see it in the 12th month, first year result. Yes, his crown is totally covered. He still has some improvement in the front and the crown too, but he needed nearly for the all head. So for these patients, we always plan 2 sessions, but we extract the maximum amount of graft number so we can give him the best coverage we can give in 1 session. And some of these patients really do not want the 2nd session, and they are really happy with only 1 year result and 1 session result. So we give them a chance to have the best coverage in 1 session. And we will see if he will want to come or not in the upcoming months. Please do not hesitate to ask any questions in your mind. Write the comments below and we will get in touch with you. Thank you.